Hello, everyone. My name is Dr. Michael Wald, and welcome to Ask the Blood Detective. Today's podcast topic is migraine makeover. Before I begin to describe both the medical and the alternative and or holistic aspects of migraine and other types of headaches, I want to first just give a little bit of information on myself. I've been practicing for around 30 years in the area of integrated or holistic medicine. I'm a doctor of chiropractic. I'm a dietitian. I have a board certification in nutrition, and I'm a life coach and even provide acupuncture. My office is located in Chappaqua in Westchester, New York, which is located an hour north of New York City. My website is drmichaelwald.com, and to send me your comments about the show or show topics, you can email me at info@blooddetective.com or call me at 914-552-1442. Okay, so let's get into what I call migraine makeover. So I've seen dozens upon dozens of people with all manner of headaches, including migraine, since the inception of my practice in approximately 1992. And I can tell you that nutrition and lifestyle improvements absolutely can make a difference for migraine sufferers. I've seen individuals who want to avoid the prevailing medications for migraine, which often have pretty severe side effects. Others who want to minimize the side effects and stay on the medication by using natural means or some combination of the two. So let's start with what a migraine headache actually is. So to begin with, I want you to know that this is going to be a very comprehensive talk on migraines because I haven't found any migraine podcasts that are detailed enough so that you, the listener, can be educated enough to be your own blood detective. And I've said that throughout my other podcasts. And what I mean by being your own blood detective is being armed with enough education and information so that you can question your various practitioners thoroughly in terms of what are the available options for migraine, which also include teaching you something about laboratory work, thus the blood detective, that's me. And for you being your own blood detective, I'm going to go over some labs because I'm absolutely shocked to say, although I shouldn't be because it's become the rule, that many practitioners that deal with migraines, usually neurologists, are very scant in terms of their laboratory work for each individual sufferer. They just go through the list of medications and hope for the best. So we're going to be defining what migraine is, discussing what its signs and its symptoms are. We'll review a variety of causes, everything from genetics to neck pain to sinus issues to dehydration, and how these and other, you might say, migraine triggers can cause migraines. I'll also be reviewing the top 20 nutritional deficiencies that I've seen over the course of the last few decades in most of my migraine patients. And as I mentioned, I will be discussing some laboratory work that'll bring it to the next level. So a migraine headache is a type of headache characterized by moderate to severe pain. It typically affects one side of the head. It's often accompanied by symptoms such as nausea, vomiting, and sensitivity to light and sound. Migraines can last from a few hours to several days, and they can significantly impact a person's daily activities and overall quality of life. I used to suffer from migraines as a teenager, which were just horrible. I remember just throwing up all the time, having severe vertigo, having scotomas and blind spots and scintillating symptoms and flashes before my eyes. And the only relief I got was from my father, who was a holistic healthcare provider and taught me about nutrition, improved my lifestyle, and my migraines went away. Now, that doesn't guarantee that your migraines will go away if you do what I did, but if your migraines are triggered by nutritional reasons and environmental factors that can be identified and focused on, then you have a greater than average chance. So migraines are believed to be caused by a combination of genetic and environmental factors. And even if you buy the narrative that they're genetic, you have to realize that genetics are influenced more or less by the environment. So for example, if your environment consists of eating cocoa and you're genetically predisposed to a problem with that, that can trigger a migraine. The same with orange juice or even rice. And even the use of nutritional supplements, let's say resveratrol, which is found in red wine. Now, many people with migraines do get headaches from alcohol, particularly wine, because of the sulfites, presumably, and sulfates. And my point is, if you were to take a nutritional supplement of resveratrol, which is, as I mentioned, something that is in wine, you may be able to modify the genetic expression of your migraines in a favorable way. So this is how the genetic aspect should not be considered something that you can't do anything about, because oftentimes you can with factors just like nutritional supplements and dietary factors, and they have what are called epigenetic effects. There are effects on top of genetics, epi, that can influence the expression of the genes one way or another, for the good or for bad. So migraines are also caused, and almost always involve neurotransmitter imbalances. That's why physicians today, both primary healthcare providers, even ENTs and neurologists, are using antidepressant medications like amitriptyline and nortriptyline to affect very favorably in some people migraines. Also, migraines can be caused by inflammation and changes in the brainstem and its surrounding structures, because they're thought to play a role in migraine development. Triggers for migraines, as I've mentioned, can vary from person to person. They might include stress, hormonal changes, certain foods, alcohol, and lack of sleep. We're going to go over many more as we move along. So what's the incidence of migraines in young adults as well as men and women of all ages? So migraines can affect anyone, and it doesn't matter what your age is, and they're more common in young adults and in women in particular. According to the Migraine Research Foundation, approximately 12% of the population experiences migraines, and 18% of women and 6% of men suffer from them. So the incidence of migraines in adults, particularly between the ages of 18 and 44, is higher than in any other age group, 18 to 44. Signs and symptoms. A sign is what your doctor or practitioner can see, and symptoms are what you report, just so you know. The signs and symptoms of migraines can vary from person to person and between the sexes. However, there are some common symptoms experienced by many migraine sufferers. They include moderate to severe pain, usually on one side of the head. That's a clue, although you can have pain on both sides of the head in migraine. It's just much more common on one side. And the discomfort would be throbbing or pulsating pain. There could be nausea and vomiting. Photophobia, which is a fancy term for sensitivity to light. Also sensitivity to the sound and smells. There are visual disturbances in most people, usually during the prodromal phase of migraines, but they could last past that, such as seeing spots or squiggly lines called scotomas. Even loss of vision. I remember experiencing loss of vision that lasted more than 30, 35, 45 minutes on multiple occasions. I just could sit down. I couldn't do anything else. And then fatigue and difficulty concentrating are common migraine symptoms. Now, in some cases, migraines can be preceded by what's known as an aura, which is, you might consider it a warning sign that a migraine is about to occur, but it's actually part of the migraine. Aura symptoms include visual disturbances, tingling or numbness in the face or the limbs, and even difficulty speaking or formulating your words. So what are some signs and symptoms that might differ from person to person and between the sexes? That's important because oftentimes, quite often, migraines are misdiagnosed. A person could have symptoms that resemble multiple sclerosis, and they actually are migraines, and vice versa. And the reason why I mentioned the multiple sclerosis and migraine is because there were several instances where I've seen clients that were diagnosed with migraines over the years, and they actually had multiple sclerosis. So the signs and symptoms of migraines can differ among individuals and between the sexes. Some people might experience mild discomfort, while others may experience debilitating pain where they just can't do anything. The frequency and duration of migraines can also vary from person to person. Women are much more likely to experience migraines with aura and are also more likely to have hormonal migraines, which are triggered by changes in hormonal levels, such as during menstruation, pregnancy, or menopause. Now, additionally, women may experience migraines with more severe symptoms, such as the visual disturbances, and they also tend to have a higher rate of chronic migraines compared to men. Now, men, in contrast, are more likely to experience migraines with a history of head or other traumatic brain injuries, but not always. Men are also more likely to experience migraine with aura and may have a higher rate of migraine-related symptoms such as neck pain and muscle tenderness. And usually the neck pain is in the neck, generally speaking, on the left side and may go into the left trapezius muscles. But I have also seen clients that had chronic neck pain on the right side. But statistically speaking, migraines tend to show up with muscular tension and trigger points, quite a lot of spasm on the left side of the head and trapezius muscles. Now let's get into more details about causes of migraines. So migraine headaches are a complex and multifactorial condition, and there are numerous potential causes that can trigger or contribute to the development of migraines. I'm about to review 35 possible causes of migraines to you because I have not seen anyone cover this in any sort of podcast or website this thoroughly. Before I do that, just for those of you who are just joining us, my name is Dr. Michael Wald. The podcast topic for today is Migraine Makeover. You can reach me at 914-552-1442. Email me your ideas and comments about the show at info@blooddetective.com. And there's plenty of free content, including the notes for this particular presentation, which you will find on my website at drmichaelwald.com. That's drmichaelwald.com. So of these 35 possible causes of migraines, we'll begin with just mentioning genetics. A family history of migraines can increase the likelihood of experiencing migraines. And also, number 2 would be hormonal changes, fluctuations, particularly in estrogen levels during menstruation, pregnancy, and menopause, often do trigger migraines in some individuals. Third is neurotransmitter imbalance that I mentioned earlier, changes in serotonin levels and other neurotransmitters like norepinephrine, for example, can and often do contribute to migraine attacks. And then there are, number 4, triggers from the diet, certain foods and drinks, such as aged cheeses, processed meats, which have nitrates and nitrites, alcohol for the same reason, and maybe also the carbohydrate content of alcohol. Caffeine might help or hurt migraines. And so all of these particular things can act as triggers. And if a person has particular allergies to any food, it could be broccoli, that could trigger a migraine as well. Cocoa and orange juice are other common triggers. But again, anything goes when it comes to migraines. And as far as doing food allergy tests, I would caution against that, at least not right away, simply because migraine sufferers, think of migraines as a chronic inflammatory condition, because it is. It's also an autoimmune condition. And I should mention, if I don't mention this anywhere else during this talk, that migraines also increase the risk of strokes and clotting. Now, stress. No conversation on migraines would be complete without talking about number 5, which is stress. Emotional stress and anxiety can lead to the onset of migraines in susceptible individuals for obvious reasons. Stress affects a weak nervous system. You might think of migraines as a weak or hyperreactive nervous system that doesn't react quite correctly. And once that's triggered, then anything goes with migraines. And then sensory stimuli, bright lights, loud sounds, and strong smells can trigger migraines in some individuals. Physical exertion. Intense physical activity or exertion can lead to the development of migraines. I had a client who had years of migraines. They seemed to be well controlled. For a while, they started to come back. He would find himself running long distances. He was a runner. And right in the middle of a run, he starts to develop scotomas and blind spots and visual disturbances, nausea, and extreme vertigo to the point where he had to sit or lie down on the side of the road. I eventually determined that his exercise, his long distance running, was actually the trigger of his migraines. And when we adjusted that, his migraines went away. There are weather changes. Many of you already know that barometric pressure changes, high humidity, and extreme temperatures have been associated with triggering migraines. Sleep disturbances, lack of sleep or irregular sleep patterns can be a contributing factor. Now, I'm going through these triggers rather quickly, but realize that each one of them needs an in-depth attention paid to them. because for me to say to you, for example, that sleep disturbances can trigger migraines, we would want to talk about what quality of sleep is, how much sleep you actually need for your particular life, and how it can help you get that sleep so that sleep issues are not a trigger for migraines with you. The same with any of these points. So keep that in mind as I go down this mental list. There's medication overuse. Overuse of certain medications, especially painkillers, can lead to medication overuse headaches, which do resemble migraines. And there are other environmental factors. Exposure to pollutants, smoke, strong odors may trigger migraines in some people. So doing testing to look at various environmental pollutants and triggers should be considered with each case of migraines. And then I'll mention allergies a little bit more in more detail here. Allergic reactions and sensitivities to certain substances can and often do provoke migraines. Now, foods may not promote migraines all of the time. A person might have an increased responsiveness, let's say, to the trigger of cocoa in their diet when they don't have enough sleep. So in other words, I'm just trying to get through the point that don't be confused if you believe that something's a trigger for you, even though it doesn't seem to be a trigger all of the time. Almost nothing's all of the time. But many doctors just dismiss it. They'll say, well, does that happen every time every time you drink this or eat that? And if the answer is no, they're like, well, that's not it. That is wrong. Okay, it doesn't even make any common sense. Then there are hormonal medications. Use of hormonal medications such as oral contraceptives, hormone replacement therapy can trigger migraines in many women. And then caffeine withdrawal. Abrupt cessation of caffeine consumption does lead to withdrawal headaches in susceptible people. And then jaw clenching or teeth grinding due to TMJ problems. Bruxism, which is grinding, and TMJ or temporomandibular joint dysfunction often does contribute to migraine development. Neck pain and posture issues. It sounds like common sense, but most people don't even think about this. Poor posture, neck tension can be associated with the onset of migraines. Any pain at all can trigger migraines. And then sinus issues, sinusitis, for example, or other sinus problems may trigger migraines in some people. Gastrointestinal disorders like irritable bowel syndrome have been linked to increased risk of migraines, as have many other health problems. Think of all other health problems as stressors upon the nervous system, and that's your connection to them and to migraine triggers. And then dehydration, inadequate hydration, even as little as 1% dehydration, can be a precipitating factor for migraines in many individuals. Then there's gluten sensitivity. Gluten can trigger migraines. It can even cause brain atrophy or shrinkage. There are a whole host, by the way, this is another trigger, of nutritional deficiencies such as magnesium and vitamin B2, which is riboflavin, and CoQ10 that have been associated with migraines, and many others, which we will review in a little bit. I mentioned altered sleep patterns. I bring it up again because shift workers or irregular sleep schedules may contribute to migraine development. And then there's hypoglycemia. Low blood sugar does trigger migraines. In fact, I've had clients who were diagnosed with migraine headaches, but actually what they had was hypoglycemia. And the symptoms of hypoglycemia can be headache, can be visual disturbances, cold sweats, dry mouth, all of that, shaking. It certainly sounds like migraines. And the same thing with hyper or high blood sugar. So both high and low blood sugar can trigger migraines. Then excessive noise exposure, too much light sensitivity, changes in your daily routine. Simple disruptions of regular routines or schedules may promote migraines. Emotional factors such as excitement, shock, or depression can trigger migraines. Inflammatory changes associated with everything from arthritis, let's say osteoarthritis, rheumatoid arthritis, lupus, you name the autoimmune condition, it can, and if it's inflammatory, it can trigger migraines. And of course, there are vascular influences upon migraines. Fluctuations in blood flow and what's known as vascular reactivity have been implicated in the pathophysiology of migraines. In some people, vasodilation, a larger blood vessel, stretches the nerves around that blood vessel, triggering migraines. And in other individuals, it's quite the opposite. And then there are dental issues. Dental problems such as malocclusion or dental abscesses may contribute to migraine development. And I've seen some dentists miss infections that have caused migraines. They don't seem to know how to read an X-ray. I've seen examples of infections on X-ray missed by dentists, which resulted in a person experiencing migraines for months and months and months unnecessarily. And also putting in the mouth guards of different types and night guards sometimes help, but they may not correct the problem. So something more comprehensive in terms of managing your body structure, such as chiropractic, particularly with a chiropractor who has skill in adjusting the TMJ joint, but would not only leave it at that. The TMJ joint has most of your body's proprioceptive nerves, your balance nerves. That's why boxers hit people in the chin that are in the ring, because that knocks them to the ground. But if you have imbalances in your TMJ, you definitely have structural and musculoskeletal and neuromusculoskeletal imbalances in other areas of your body. So something like foot levelers or foot inserts might help migraines. But again, sometimes it's more complicated. There may be multiple structural issues that need to be addressed in some individuals with migraines. And then there are endocrine disorders. I've mentioned that before, disorders affecting the endocrine or hormonal system, such as thyroid dysfunction, particularly hypothyroidism or low, can increase migraine susceptibility. And then any trauma to the head, sudden withdrawal from drugs, or interactions with various medications, certain medications, or their withdrawal effects often do lead to the development of migraine like headaches. And then psychological factors, depression, anxiety disorders, post-traumatic stress disorder, PTSD, are often associated with migraines. And then there are genetic syndromes or genetic disorders. There's too many to mention, which may predispose individuals to frequent or severe migraine headaches. So now we're going to move into what are some of the tests or evaluations that a person should have if they want to carefully and methodically work through what are the triggers and what are the lab representations of those triggers. And again, I think this section is particularly important for all of you out there who want to become your own blood detectives, because you would have to go to several different doctors to cover this area of my presentation right now, where I'm just going to review with you 17 different tests and evaluations which should be done. And the doctors that you see, as most of you know, they don't talk with one another. So the continuity of care just stinks. All right. So what are some of these tests and evaluations? First of all, I start with a detailed family history assessment. Gathering information about family history of migraine disorders may help, I would say, make obvious some issues that without a detailed family history would be missed. I often suggest hormonal testing when it's appropriate, especially for estrogen and progesterone, which can help me identify imbalances in these hormones, which may be contributing to menstrual-related migraines. And then there are neuroimaging studies like MRIs, magnetic resonant imaging, and scans such as CT scans, computerized tomography, may be used to rule out some structural abnormalities in the brain, which could be causing migraines. There is a type of structural abnormality called Chiari malformation, and it's got different levels, and it results in part of the brainstem and hind part of the brain, which can go through to different extents, the hole at the base of the skull called the foramen magnum. And these structural changes can increase pressure in the brain and put pressure on blood vessels or cerebral spinal fluid flow. And I should mention that if you've had MRIs before, but you haven't had a cerebral spinal flow assessment performed with the MRI, you might want to request that, because these, I should say, problems with the flow of cerebral spinal fluid are not often abnormal in those with migraines. And then there's a dietary analysis. I look at a week or 2 weeks of detailed food diary and intake, noting how much my clients are eating, how often they're drinking, and then looking for the foods, for example, that they eat most often, which they tend to be the most allergic foods, and looking at the diet for complete nutritional content of the macronutrients, the protein, carbs, and the fats, because an imbalance of any of those can trigger migraines, as well as the micronutrient assessment of the diet, which means vitamins and mineral assessment in terms of looking at the foods and saying, well, are there enough foods to cover most nutritional needs of people, especially looking for foods that contain nutrients such as CoQ10 or vitamin B2, riboflavin, and are there enough of these foods in the diet? But even if there are, a person might need much higher amounts of nutrients than foods can provide. So nutritional supplements are almost always recommended, at least by me, when dealing with migraines. And then there's stress assessments. Psychological evaluations and stress assessments help identify emotional triggers for migraine sufferers. You can have the perfect nutrition, but if your emotional stuff, if your cognitive thinking is off, if you have cognitive distortions, thinking errors, stress, poor coping skills, these are going to be issues with migraines. So we always must balance the psychological part of migraines, how the psychology, our mental, emotional health may contribute to migraines, along with the dietary analysis, along with genetic analysis, along with a structural analysis of the individual, among other things. Sensory sensitivity testing, assessing, let's say, sensitivity to light, sound, and smell, for example, with specialized tests are important. And then a physical examination, a thorough physical examination, which also includes a nutritional visual examination. So, for example, if I'm looking at you and you look to be particularly pale, you might just be nutritionally deficient. You might have an anemia, like iron anemia. You might have, let's say, little bumps on the back of your arms, near your triceps, which might indicate a vitamin A deficiency, a zinc deficiency, or a fatty acid deficiency, just to name a few. Just as dry skin might indicate a need for more water or omega-3 fatty acids or zinc or proteins, there's a lot that a skilled practitioner can determine based on just a visual look at someone. And I just gave you just a couple of things. And if you go to my website at drmichaelwald.com and you search the search bar on the homepage, you can type in any of these sorts of assessments and you'll get more information than that I'm even giving you here in writing. And then there are sleep studies. Sleep studies can be used to evaluate various sleep patterns and identify sleep disturbances that can trigger migraine. Medications, always looking at not just the medications someone's taking, but also the nutritional supplements, because many people do this wrong. They take things, they don't really have a basis for taking them, they have incomplete knowledge of why they're taking it, or completely misinterpreted why they should be taking nutrition. And the nutrients in the form of nutritional supplements or even diet, they affect your biochemistry. So they need to be carefully looked at by a qualified healthcare provider. And then allergy testing. Allergies can trigger migraines. But as I said earlier, and this is really, really important for you to hear because most of your practitioners will not know this. I wrote a 500-page textbook on how to medically and nutritionally interpret labs. And I can tell you from all of the teaching I've done over the last couple of decades that almost everyone in the audience that I lecture to does not know that if you have an inflammatory condition like migraines, you can have allergy tests reveal many, many false allergies. So you have to manage the inflammation to some extent first before these food allergy tests can be of any real use. And then I have criticisms of some of these food allergy tests. So for example, you might see a traditional allergist that might put certain foods in your skin on your back looking for reactions. That's very different than the reactions your immune system might have, which is located in your small intestine. 70% of your immune system is in your small intestine. And furthermore, a person might have many false allergy tests because, number one, they react to something they ate because maybe they don't make enough stomach acid or pancreatic enzymes. And none of these considerations are considered when a food allergist puts the food samples in your skin. So even if you react to something in your skin, That doesn't mean you're going to react to it when you have it orally by mouth, and vice versa. And then there's a dental evaluation. I certainly evaluate the mouth and the neck and the rest of the structure of the body, but a good dental examination can help identify dental issues such as bruxism or TMJ that might be contributing to headache symptoms. And then a very careful and in-depth nutritional assessment. A blood test, for example, for nutrient levels can help identify deficiencies that could be triggering migraines. You might have not deficiencies, but you might have excesses or some other imbalances, of various nutrients that can all trigger migraines. And then I mentioned hormonal tests or endocrine function tests. I'll add a few others like thyroid testing. And there are some other endocrine parameters that can help identify any underlying endocrine or hormonal disorders that can be influencing migraine. I've definitely found some individuals with hormonal conditions, diseases, that they did not know about, which explains why none of the prevailing therapies for migraines work with them, because they don't focus on that. I will also test for inflammatory markers, blood tests, even some urine tests for inflammatory markers, help assess the underlying inflammatory conditions that could be linked to migraine. Definitely vascular studies like Doppler ultrasound, psychological evaluations to help identify underlying factors like stress, depression, that sort of thing, anxiety that might trigger migraines. And I mentioned a few times genetics. There are some genetic tests that I will sometimes look at. A very common genetic glitch in people is abnormalities in one or both of what are known as their MTHFR genes. That's as much as I can say about that right now due to time constraints. So what I'm going to do here as we end is I'm going to review with you 20 nutritional deficiencies that are common in migraine sufferers that I've seen. Now, you might have some of these, you might have all of them, although that's doubtful, and you might have your own unique combination of nutritional deficiencies or excesses even, but I'm going to give you my insights for the top 20. So the first one, and these aren't necessarily in order of the prevalence that I've seen, but they are all in the top 20. Vitamin B2, which is also known as riboflavin. So deficient vitamin B2 plays a crucial role in energy production in the body. Also red blood cell formation and maintaining the health of the nervous system. So a deficiency of vitamin B2, which is the vitamin, by the way, that causes your urine to become orange, can lead to migraines due to its role in the production of ATP. Now, this doesn't mean you should run out and just take vitamin B2 because you might cause imbalances of other nutrients, but I just want you to know that this is something you should be considering. And then there's vitamin B9. That's folic acid. So folate deficiency is essential for the production of red blood cells. So if you're deficient in folic acid, you're not going to produce enough red blood cells. If you're not going to produce enough red blood cells, that's going to put a stress on your entire physiology. That's enough to trigger migraines right there. But if you have inadequate production of red blood cells, that's also known as a folic acid anemia, and you're not going to have enough cells to oxygenate properly, so your body's going to stress because of that. And or it might produce too much lactic acid, which can trigger migraines, all from folic acid deficiency. And then there's B12 or cobalamin deficiency. Now, there are several forms of B12. There's a cobalamin, there's methylcobalamin, there's adenosylcobalamin. These are different forms of of B12 that may or may not be best for each person. So in one person, maybe they are best with B12 that's in the cobalamin form, and another person, the B12 that's in a folic acid form or adenosyl form, etc. But vitamin B12 is necessary for basic functions of the nervous system, and again, like folic acid, for the production of red blood cells. And a deficiency of B12 can lead to migraines due to its role in the synthesis of myelin, the protective covering of nerve cells. So if you're B12 deficient, you might have plaques in your brain called myelin or demyelination. And that might be mistaken for multiple sclerosis. And your neurologist will look at your MRI and say, well, those plaques are not around this particular area of the brain that we call the ventricles. yes, they're there, but since they're not around the ventricles, we're not going to call it migraine. We're going to call it probable MS or not MS. The point I'm trying to make here, folks, which really, if you have been listening, you can hear the frustration in my voice, is that sometimes practitioners, particularly neurologists I've seen, they are too dependent on exacting criteria. For example, if you're going to diagnose someone with MS, they need to have their plaques around the ventricles. If they're not around the ventricles but somewhere else, everyone's confused in neurology. So again, the point here is that B12 deficiency can look very similar to multiple sclerosis and vice versa. And then there is vitamin D deficiency. Vitamin D is essential for the regulation of calcium and phosphate levels in the body. And a deficiency can lead to migraines due to its role in the regulation of neurotransmitters. Now, the blood test for vitamin D has a range of 30 to 100. Most doctors say if you're 31, you're normal. We want you to be no less than a 50. And the real studies, the meta-analysis studies, say that you want to be a 70 on the vitamin D scale. And I'm going to back up for a moment real quick and tell you, too, that for B12, the best test for that is not a serum or plasma B12 test. It's a microscopic test where your blood is looked at under the microscope. If you have large red blood cells, that may indicate a B12 deficiency. For folic acid, it's very similar to B12, large red blood cells. And for vitamin B2, that's generally fairly accurate in the serum or the plasma. The next nutrient is magnesium. Magnesium is essential for over 500 enzymatic functions in the body, including those involved in nerve function and muscle relaxation. So deficiency of magnesium can lead to improper nerve functioning and muscle spasms. And sometimes I'll use a serum magnesium test. If I want a level of magnesium that sort of goes further back into a person's history, I'll measure magnesium levels in a white blood cell because white blood cells live longer than red blood cells. And then there's coenzyme Q10. It's a powerful antioxidant that plays a vital role in energy production within cells, and a deficiency can lead to migraines due to its role in maintaining the health of the mitochondria, the powerhouses of the cell. There's no real good test for CoQ10 other than therapeutic response, but there are blood tests for it. I just don't find them very accurate. And then there's iron deficiency, which is also known as anemia. There are over a dozen forms of anemia, but iron is the most common, probably the only one you've ever even heard of. I checked for all of them because they can all trigger migraines and perpetuate migraines. So iron is essential for the production of red blood cells, which, as you probably know, carry oxygen throughout the body. And a deficiency can lead to migraines due to its role in oxygen transport, that means iron, and the maintenance of proper brain function. So if you're deficient in iron, you can have oxygen delivery problems. Your blood vessels in your brain are probably going to vasodilate, get larger. That's going to stretch the nerves around them, and that can lead to migraines. Now, you should only take iron if you are anemic and only if the cause of the anemia has been uncovered. Because if you're anemic because you have intestinal bleeding from colon cancer, for example, as opposed to internal or external hemorrhoids or menstruation, obviously there's a big difference. And you don't want to be masking causes of iron anemia that could be grave. And then there's zinc deficiency. Zinc is essential for something like 250 enzymatic functions. It also is essential for immune function, protein production or synthesis, and cell division. If you have a deficiency of zinc, that can lead to migraines due to its role in the regulation of neurotransmitters as well. And then so again, the best test for zinc might be a regular blood test or the speed of a white blood cell as viewed under a microscope. That is a functional test. That is what I prefer. And then there's copper deficiency. Copper is an essential trace element. It plays a role in the production of red blood cells, but also white blood cells. And copper is needed in the body for the production of collagen and elastin for tissue repair. And collagen and elastin is also in our blood vessels. So a deficiency of copper can lead to migraines due to its role in the production of neurotransmitters. For example, copper is needed to manage your stress response by influencing the production of norepinephrine. And then there is, and the best test for copper would be sometimes serum levels, but there is a test known as ceruloplasm. I'll say it again, ceruloplasm, which is a much longer intake test for copper and storage of copper. And then there's potassium deficiency, known as hypokalemia. So potassium is an essential electrolyte, and it helps maintain fluid balance, nerve function, and muscle contraction. So clearly, all of those are involved in migraines potentially, which can be caused by potassium. And, some people say, if they eat a banana, they cure their migraines. I've yet to find one of these people. But it's fine to eat bananas as long as there's not any other reason for you, because they are high in potassium. A deficiency of potassium can lead to migraines due to its role in maintaining proper nerve function and preventing muscle spasms. And then there's sodium deficiency, known as hyponatremia. Sodium is an essential electrolyte. It helps maintain fluid balance and nerve function. So clearly that's an issue, and that can be accurately measured in the serum or the plasma. And then there's calcium deficiency. Now, calcium is needed for bones. Most of us know that, but also it has an essential role in nerve and muscle function and maintaining the entirety of the musculoskeletal system in the body. And a deficiency of calcium can lead to migraines because calcium is involved in neuroplasticity, which is the reparative process in the brain. The best tests for calcium are serum calcium levels, but more ideally ionized calcium levels. Almost no doctor measures that. Why? They clearly just don't know that ionized calcium is better than a regular serum calcium test. And then there's omega-3 fatty acids. So they're needed for brain function and nerve function. Brain and nerve are composed largely of omega-3 fatty acids. So a deficiency can lead to migraines because the omega-3s also have anti-inflammatory effects on the nervous system. There are tests for omega-3 fatty acids. I don't find them particularly accurate, so I rely on giving my client the proper balance of omega-3s. There are many different formulations of omega-3s. You might have heard that omega-3s consist of EPA and DHA. These are some of the structural components of omega-3s. And I find that most migraine sufferers will benefit more from an omega-3 fatty acid supplement that has higher amounts of the DHA component. And those with cardiovascular disease tend to do better with omega-3 fatty acids with a higher content of the DHA part of the EPA DHA of fish oil. And then there's glutamine. That's an amino acid that has a critical role in nervous system function and immune function, also gastrointestinal health. So a deficiency of glutamine can cause migraines, but also an excess of glutamine can cause migraines. There are amino acid tests. Glutamine is an amino acid that can let you know about the levels. And then there are other amino acid deficiencies, or what I would call essential amino acids. Glutamine, by the way, is not an essential amino acid. You can look up online what the essential amino acids are, the non-essential ones are, and the conditionally essential ones are if you have an interest. Also on my website at drmichaelwald.com, put in amino acids and proteins in the search bar and something should come up. So we need the amino acids because they help form neurotransmitters in the brain. And neurotransmitter dysfunction is a hallmark of migraines. No matter what the triggers, they end up causing neurotransmitter imbalances. And then there's hydration. Even as low as 1% of dehydration can trigger migraines by affecting adversely lots of different systems in the body. Just a few more, guys. Just 3 more. Hang in there. And then there's alcohol consumption. We think that alcohol triggers migraines due to its effect on the nervous system. It promotes dehydration, but also alcohol increases histamine in the body. So it's a histamine promoter. And there are many other potential histamine promoters. If they're used correctly, if you burn out someone's histamine, which tends to vasodilate, you might shorten the duration of the migraine. But if you don't do that correctly, you can elongate the duration of the migraine. And then there is caffeine withdrawal. Caffeine is obviously a stimulant that can trigger migraines when it's consumed in large amounts and then suddenly withdrawn. There is medical literature that says that migraines may help. Caffeine, I should say, can help migraines or even worsen migraines. That's something you want to find out with trial and error under the auspices of a qualified healthcare provider so that they can see how you react. And then last but not least, as I've mentioned before, but I wanted to reiterate it again, food sensitivities and allergies. Now, an allergy by definition involves the immune system. A food sensitivity does not involve the immune system. It may be that a person has sensitivities that may look just like allergies, but do not involve the immune system, because what is involved instead of the immune system in food sensitivities is low stomach acid, for example, and or low production of protein, carbohydrate, and fat digesting enzymes from the pancreas. So the treatment would be to give stomach acid and or pancreatic enzymes, and that will help a person digest foods so that they're small enough that they don't trigger immune reactions, and small enough so that they're digested properly and do not trigger neurologic stress. Okay, now I know that was a lot. So of course you can listen to this presentation again. You can download the notes at www.drmichaelwald.com. Please do email me your show topics. I take them seriously at info@blooddetective.com. And you can reach out if you'd like to work on your migraines with me at 914-552-1442. Thank you so much, everyone, for listening to today's podcast, Migraine Makeover. My name is Dr. Michael Wald, the Blood Detective, and it was great spending this time with you. See you next time.